on left ventricular hypertrophy, and we are going to talk about and we are going to read from the website Mayo Clinic, United States of America. This website and the clinic Mayo Clinic is very well known and famous across the globe. So I think if you are versatile in English, if you are versed in English, I think you should try to regularly visit or browse the features and browse the pages of Mayo Clinic. Now let's talk about Mayo Clinic, and today our topic is left ventricular hypertrophy. Left ventricular hypertrophy is a heart disease. Left ventricular hypertrophy is the thickening of the walls of the lower left heart chamber. The lower left heart chamber is called the left ventricle. The left ventricle is the heart's main pumping chamber. During left ventricular hypertrophy, the thickened heart wall can become stiff. Blood pressure in the heart increases. The changes make it harder for the heart to effectively pump blood. Eventually, the heart may fail to pump with as much force as needed. Uncontrolled high blood pressure is the most common cause of left ventricular hypertrophy. Complications include irregular heart rhythms called arrhythmias and heart failure. Treatment of left ventricular hypertrophy depends on the cause. Treatment may include medications or surgery. Now let's talk about the symptoms of left ventricular hypertrophy. The symptoms of left ventricular hypertrophy are: left ventricular hypertrophy usually develops gradually. Some people do not have symptoms, especially during the early stages of the condition. Left ventricular hypertrophy itself does not cause symptoms, but symptoms may occur as the strain on the heart worsens. They may include: number one, shortness of breath, especially while lying down; number two, swelling of the legs; number three, chest pain; number three, chest pain when often when exercising; number four, sensation of rapid fluttering or pounding heartbeats called palpitations; number five, fainting or a feeling of lightheadedness. Bhabi Labhar has commented, but I cannot understand what he has said. Okay, let's see when to see a doctor if you have left ventricular hypertrophy. Seek emergency care if you feel chest pain that lasts more than a few minutes, if you have difficulty breathing, if you have severe lightheadedness or if you lose consciousness, if you have a sudden severe headache, difficulty speaking, or weakness on one side of your body, if you have mild shortness of breath or other symptoms such as palpitations, see your healthcare professional. If you have high blood pressure or another condition that increases the risk of left ventricular hypertrophy, your healthcare team is likely to recommend regular health checkups to check your heart. Soccer girl, hi. We are going to talk now. We are talking about hypertrophy, left ventricular hypertrophy. Gramin Korina, hi. Okay, Gramin Guranio, hi. We are talking about left ventricular hypertrophy, a condition of the heart. I am Gisi. Okay, Gramin Gisi. Okay, Gisi. Okay. Please continue showing your comments. We are talking about now. Let's talk about the causes of left ventricular hypertrophy. Anything that puts pressure on the heart's lower left chamber can cause left ventricular hypertrophy. The lower heart chamber is called the left ventricle. As the strain on the lower left chamber increases, the muscle tissue in the chamber wall thickens. Sometimes the size of the heart itself also increases. Left ventricular hypertrophy also may be caused by gene changes that affect the heart muscles structure, things that can cause the heart to work harder and may possibly lead to left ventricular hypertrophy include number one, high blood pressure, also called hypertension. This is the most common cause of left ventricular hypertrophy. Long term high blood pressure strains the left side of the heart, causing it to grow bigger. Treating high blood pressure can help reduce left ventricular hypertrophy symptoms and may even reverse it. Number two, the second cause of left ventricular hypertrophy is narrowing of the aortic valve. The aortic valve is between the lower left heart chamber and the body's main artery called the aorta. Narrowing of the valve is called aortic stenosis. When the valve is narrowed, the heart must work harder to pump blood into the aorta. Number three, the causes number three is intensive athletic training. David Rossetti, just to know, I suggest you to choose Edgar Allan Poe in the next few years. Economy will go under Purizogla's hypertrophy. Okay, David Rossetti, thank you for your nice comment. Intensive athletic training, intense long-term strength and endurance training causes changes in the heart. The changes help the heart handle the extra physical workload, but the changes can make the heart muscle grow larger. Sometimes this is called athlete's heart or athletic heart syndrome. It's unclear whether the increased heart size in athletes can lead to stiffening of the heart muscle and disease. Certain conditions passed down through families called genetic conditions can make the heart thicker. They include number one, hypertrophic cardiomyopathy. This condition is caused by changes in genes that cause the heart muscle to thicken. The thickening makes it harder for the heart to pump blood. It can occur even without high blood pressure. People with one parent with hypertrophic cardiomyopathy have a 50% percent chance of having the changed gene that causes the disease. Number two, amyloidosis. Amyloidosis is proteins build up around the organs, including the heart. The collection of proteins interferes with how the organs work. When the condition is passed down through families, it is called familial amyloidosis. It may it also may affect the nerves and kidneys. Now we are going to talk about the risk factors of left ventricular hypertrophy. Risk factor means the things that cause left ventricular hypertrophy. Things that increase the risk of left ventricular hypertrophy include number one, age. Left ventricular hypertrophy is more common in older people, so is high blood pressure, which can cause heart muscle thickening. Number two, weight. Being overweight increases the risk of high blood pressure and left ventricular hypertrophy. Number three, family history. Changes in genes passed down through families may lead to left ventricular hypertrophy. Number five, diabetes. Having diabetes increases the risk of left ventricular hypertrophy. Number six, female gender. Women with high blood pressure are more likely to get the condition than are men with similar blood pressure measurements. Okay, now these all are the complications, risk factors for left ventricular hypertrophy. Now let's talk about the complications of left ventricular hypertrophy. Complication means these things can go to further deterioration. Complications of left ventricular hypertrophy. Left ventricular hypertrophy changes the structure of the heart and how the heart works. The thickened left ventricle becomes weak and stiff. This prevents the lower left heart chamber from filling properly with blood. As a result, blood pressure in the heart increases. Complications of left ventricular hypertrophy include heart failure, number two, irregular heart rhythms called arrhythmias. Number three, too little oxygen to the heart called ischemic heart disease. Number four, sudden unexpected loss of heart function, breathing, and consciousness called sudden cardiac arrest. Now let's talk about prevention of left ventricular hypertrophy. Prevention means if you do this, you can stop left ventricular heart hypertrophy. The prevention of left ventricular hypertrophy. The same healthy lifestyle changes recommended to treat high blood pressure also help prevent left ventricular hypertrophy. Try these tips. Number one, don't smoke. Number two, eat healthy foods. Number three, use less salt. Number four, limit or avoid alcohol. Number five, get regular exercise. Number six, maintain a healthy weight. Number seven, get 7 to 9 hours of sleep daily. Number eight, manage stress. Stress means any kind of mental or psychological pressure. Uncontrolled high blood pressure increases the risk of left ventricular hypertrophy. Get your blood pressure checked at least every 2 years if you are 18 and older. Get your blood pressure checked at least every 2 years. If you have risk factors for heart disease or are over age 40, you may need more frequent checks. Ask your healthcare team what blood pressure reading is best for you. Ask your healthcare team what blood pressure is best for you. Your healthcare professional may recommend checking your blood pressure at home. High blood pressure monitors are available at local stores and pharmacies. Now, so that's all. Now let's talk about the diagnosis and treatment of left ventricular hypertrophy. How we can diagnose left ventricular hypertrophy and what are the treatment plans available for left ventricular hypertrophy. So, since left ventricular hypertrophy is the thickening of the walls of the lower left heart chamber, so that's why everybody should be very careful. We should always try to get regular exercise. We should always try to maintain a healthy weight. We should always have our blood pressure under control. And if we are smoking, we should quit smoking because smoking is the root cause of all diseases in human body. And if you are alcoholic or if you are to use alcohol, try to avoid it or try to limit the intake of alcohol. So limiting alcohol use can also help you maintain a good heart, healthy heart. And if you are knowledgeable about English language, I think you should always try to visit the website of Mayo Clinic. I always try to take help from the website of Mayo Clinic, and the writings on the website of Mayo Clinic can make you a little bit aware about all the diseases of human life. Ace of ice, I usually was heart attack. Just to know, David Rossetti, the hardest thing is to recognize that athletic Bilabo will never be like the SEPI pronunciation team. Okay, so let's talk about left ventricular hypertrophy, the diagnosis of left ventricular hypertrophy. To diagnose left ventricular hypertrophy, a healthcare professional does a physical exam and asks questions about your symptoms and family's health history. The care professional checks your blood pressure and listens to your heart with a device called a stethoscope. There are some tests by doing which we can diagnose that you are suffering from left ventricular hypertrophy. Tests used to diagnose left ventricular hypertrophy may include number one, lab tests. Blood and urine test may be done to check for conditions that affect heart health. Test may be done to check blood sugar, cholesterol levels, and liver and kidney function. Electrocardiogram, also called ECG or EKG, this quick and painless test measures the electrical activity of the heart. During an ECG, sensors called electrodes are attached to the chest and sometimes to the arms and or legs. Wires connect the sensors to a machine which displays or prints results. An ECG can show how well the heart is beating. Your care provider can look for signal patterns that suggest thickened heart muscle tissue. Test number three is echocardiogram. An echocardiogram uses sound waves to create pictures of the heart in motion. This test shows blood flow through the heart and heart valves. It can show thickened heart muscle tissue and heart valve problems related to left ventricular hypertrophy. And the fourth test is heart MRI. This test, also called a cardiac MRI, uses magnetic fields and radio waves to create detailed images of the heart. Okay, so this is how we can diagnose that we have left ventricular hypertrophy. Now let's talk about the treatment plans of left ventricular hypertrophy. Treatment for left ventricular hypertrophy depends on the cause. It may include medicine, catheter procedures, or surgery. It's important to manage conditions such as high blood pressure and sleep apnea, which can cause blood pressure to be higher. Medications is one of the treatment. Now let's talk about the medications used for left ventricular heart failure or all types of heart diseases. Medicines are used to treat symptoms and prevent complications of left ventricular hypertrophy. Blood pressure medicines may help reduce or prevent thickening of the heart muscle. The type of medicine used depends on the cause of left ventricular hypertrophy. Medicines that might be used to treat left ventricular hypertrophy or the conditions that cause it include medicine number one, angiotensin converting enzyme inhibitors, or this is simply called ACE inhibitors. This is a group of medicine used for the treatment of heart diseases. These medicines widen blood vessels to lower blood pressure. They can improve blood flow and decrease the strain or the pressure on the heart. Side effects include a persistent cough. Number two medicine is angiotensin 2 receptor blockers. It is simply called ARBs. This is ARBs or angiotensin 2 receptor blockers is also a group of medicine. These medicines have benefits similar to ACE or angiotensin converting enzyme inhibitors, but don't cause a persistent cough. Medicine number three, beta blockers. Beta blockers is also a group of medicine. These medicines help control the heart rate. They also help the heart move blood with less force. And medicine number four, water pills, also called diuretics. These medicines reduce the amount of fluid in the body, lowering blood pressure. So this is all about the medications on the treatment of left ventricular hypertrophy. There is another treatment plan, and that is surgery or other procedures. Left ventricular hypertrophy that is caused by aortic valve stenosis. Stenosis means narrowing of the aorta. Aortic valve stenosis might require a catheter procedure or surgery to repair or replace the valve. Surgery or other procedures may be needed to treat underlying conditions such as hypertrophic cardiomyopathy or amyloidosis. Now let's talk about hypertrophic cardiomyopathy. Surgery can be done if the condition causes heart failure symptoms or a blockage that interferes with the heart's pumping action. Amyloidosis, if other treatments don't work, stem cell transplant may be needed. Treatment for amyloidosis is available at specialized clinics. Together, you and your care team can develop a treatment plan that's best for you. Now let's talk about, so this is all about treatment plan and surgery process. Now let's talk about lifestyle and home remedies. Your lifestyle changes and your home remedies can also help you be free from left ventricular hypertrophy or hypertrophic cardiomyopathy or any other cardiac problems or heart diseases. So let's talk about how lifestyle and home remedies can help us be free from heart diseases. Lifestyle changes can help lower blood pressure and improve heart health. Try these healthy lifestyle changes. Number one, eat a nutritious, healthy diet. Number one, eat a nutritious, healthy diet. Choose fruits, vegetables, whole grains, low fat dairy products, and good fats such as olive oil. Limit foods and beverages higher in added sugars, salt, and saturated fat. Choose low sodium or no salt added foods. Don't add salt to your meals. Number two, don't smoke or don't use tobacco. Quitting is the best way to reduce the risks of heart disease and its complications. If you need help quitting, talk to your healthcare team. Number three, limit or avoid alcohol. Alcohol can raise blood pressure, especially if consumed in large amounts. If you choose to drink alcohol, do so in moderation. For healthy adults, that means up to one drink a day or one drink per day for women and up to two drinks per day for men. Number four, exercise regularly. Regular physical activity helps to lower blood pressure. With your healthcare teams, okay, aim for at least 30 minutes of physical activity most days of the week. Some sports or exercises can temporarily raise blood pressure. Talk to your care team about the amount and type of exercise that's best for you. Number six, number five, manage weight. If you are overweight or have obesity, losing just a few pounds can help lower blood pressure. Weight loss may help reverse left ventricular hypertrophy. Talk with your healthcare team to set realistic goals for weight. Number six, manage stress. Stress means any kind of mental or psychological pressure that you feel during your daily life. Find ways to help reduce emotional stress. Getting more exercise, practicing mindfulness, and connecting with others in support groups are some ways to reduce stress. So this all about the lifestyle and home remedies of heart disease and especially on left ventricular hypertrophy. Now let's talk about preparing for your appointment, how you can prepare yourself for your appointment with your cardiologist. You may be referred to a doctor trained in treating heart diseases or cardiologist. This type of healthcare professional is called a cardiologist. What can you do? Write down your symptoms, including any that may seem unrelated to the reason you scheduled the appointment. Make a list of all your medicines, vitamins, and supplements. Include the dosages. Write down important medical information, including other conditions you may have. Write down important personal information, including any recent life changes or stressors that put pressure in your life. Write down questions to ask your healthcare team. Find out if your family has a history of heart disease. Ask anyone to come with you to help you remember what the care provider says. So there are some questions to ask your doctor. When you are going to meet your cardiologist, you can ask the following questions. Number one, what's the most likely cause of my symptoms? Number two, What test do I need? How do I prepare for them? Number 3, what types of treatments do I need? Number 4, should I make any lifestyle changes? Number 5, should I restrict any of my activities? Number 6, I have other health problems. How can I best manage these conditions together? Don't hesitate to ask any other questions during your appointment. Now, what to expect from your doctor? What you can hope from your doctor if you are at the on the appointment with your doctor. Your healthcare professional is likely to ask you many questions. Being ready to answer them may leave time to go over items you want to spend more time on. You may be asked, what are your symptoms? When did the symptoms start? Have your symptoms gotten worse over time? Uh, do you have chest pain or rapid fluttering or pounding heartbeats? Do you have dizziness? Have you ever fainted? Have you had trouble breathing? Does exercise or lying down make your symptoms worse? Have you ever coughed up blood? Do you have a history of high blood pressure or rheumatic fever? Uh, do you have a family history of heart problems? Do you smoke or did you smoke? Do you use alcohol or caffeine like tea, coffee? So that's all about left ventricular hypertrophy. Prevention is always better than cure, and if we become careful, if we try to prevent our diseases by regular exercising, by eating nutritious food, by having a healthy blood pressure, by regularly checking our blood pressure, by controlling our diabetes, by controlling being overweight, uh, and by removing the stress, the mental pressure, the psychological pressures that we are regularly facing during our life. So, by doing this, we can avoid not only left ventricular hypertrophy, but also all other diseases related to cardiology or related to your heart. So, I hope through this video we will be more conscious about our heart, because you have only one heart. You have two kidneys, you have two eyes, you have two sets of jaws of teeth, you have two nostrils in your nose, you have 2 ears in your head, but you have only one heart. And if the heart stops beating, should I say, you are going to die. So if you don't want to die, you should keep your heart healthy by eating nutritious food, by taking regular exercise, by avoiding alcohol or smoking or any kind of tobacco related products. So I hope this video will make you conscious about left ventricular hypertrophy, a heart condition. So wishing you all a good heart, good healthy heart. Wishing you all a good future, good tomorrow, because we are the person given to imagining a better tomorrow for you, for me, and for everyone in the world. So wishing you all a good health. Thank you for watching this video. This is a channel of entertainment. This is a channel of education. If you like, you can hit the bell icon, and you can be a subscriber to this channel. You can also have your valuable comment. Today, Ace of La Eyes, David Rossetti, and many others have already commented on this live streaming. So, since health is wealth, we should value our health. We should treasure our health. We should prioritize our health. We should give priority on our health instead of searching wealth. Because if you continuously earning, if you are continuously earning wealth, this wealth will one day is going to damage your heart health or your health. So try to stay fit, keep fit, and thank you. Bye bye for watching for this long time. Thank you. Bye bye.